Good morning. My name's Alex Priest and I'm the Community Champion for Connect Somerset for the South Petherton and Somerton areas. One of the beauties of Connect Somerset is it's all about making connections and having lots of different roles and hats and being embedded in the community. So I have other roles in the community, which is that I'm Chief Executive of Mind in Somerset, the mental health charity. And I'm also a non-executive director on the board of Somerset NHS Foundation Trust. And you'll hear why lots of our champions have many of those similar links later on and why that's important. Connect Somerset is an initiative from Somerset Council. It's really based on three pieces of useful information and background. The first is that programs that are local and community based always work better than where statutory organisations such as the council try to impose things centrally, and partnerships with the local community in local places always work better in terms of development of children, families, young people and communities. The second, that evidence from around the country and a number of local authorities has shown that these sort of programs really work well, and I'll come on to explain exactly what the program is, in improving connections and improving access to services and making more joined up thinking and better commissioning and allowing professionals to communicate better and getting ultimately the best outcomes for members of the community and especially for parents and families. Finally, an overriding acknowledgement from the council that early help is the best form of intervention, that waiting until things have become more problematic for everyone is not the way forward, that early help means that the bubble doesn't burst further down the line at great cost. I don't mean financial cost, but there may be financial cost to the family, to the young person, and that actually the earlier we can get support to families and young people, the better. And those are the areas I'm going to be concentrating on today. It is a partnership between the Somerset Council, the NHS and the voluntary community and faith and social enterprises, which to you and me means charities, local town councils, community group, community interest companies, schools, playgroups and all sorts of other organisations, all of which are embedded in their community. And that's important for the success of the venture. There's some really good research by the Joseph Rowntree Foundation that effectively says that unless initiatives that come from council are rooted in their community, then they won't succeed. Unless they're partnered with community motivators and connectors, that actually all that will happen is a lot of people in Somerset and Taunton will get very excited about something and it won't have any practical effect in our villages and towns around the county. And Somerset Council's recognised that's the case and is trying to do things a little bit differently with a different philosophy. We've found in the past, or there's been a belief in the past, that the more you meet demand with service, the more the demand will grow, and then the more the demand on services will grow, and then you'll need to spend more money on the services, and then the demand will grow. So in the past, lots of organisations in other systems around the country, in this system, have put up barriers between demand and service, thresholds in order to access services, forms that are complicated, people who are hard to get hold of, phone numbers that don't work. And what actually happens in practice is that the demand doesn't go away, it increases and becomes more complex. And actually where access to that service had happened, if access to that service had happened sooner, we'd have actually had much better outcomes for all. And part of this initiative is to try and address that. We know that in Somerset, in common with the rest of the country, there are a number of challenges for parents, carers and families. Some of those are summarised here in statistics and metrics, and some of these are really quite startling, and we have all felt the effect of these on our families, on our households, and these go on to exacerbate some of the more complex needs for families, for young people. And so it's important that we address this with a philosophical movement that is Connect Somerset now to try and ensure things are more joined up. There is actually a huge amount of support around families that exists at the moment. And here are some examples of it. And just looking at these hexagons, it's astonishing, if you think about it, how many different types of support, how many different links, how many different influences there are on young people and on their families. But they're not always joined up. And if as a family you don't have access to some of these things because you don't know how to access them, or because, more importantly, more bluntly, we haven't made it easy to access them as a system, then you can't seek that support and your outcomes will be worse. And that feeds into all sorts of inequalities that we're very keen to improve in the system. Within Somerset as well, there is a fantastic amount of support. Some of it's statutory, provided by the council or the NHS, other provided by charities and schools and local communities. And it's all there waiting to be accessed and linked up. What are some of the key messages that Connect Somerset is trying to get across? And then I'll talk about exactly how we're achieving that. We're trying to help more residents by helping them earlier, as I've said. We recognise that schools play a really critical part in achieving this and are at the centre of their communities and often closest to families and young people. The important thing is to empower local people to feel connected and resilient and to access services when they need to with ease and lightness of touch, and integrate those services and that support and make it closer to home and more local. Not everything needs to happen in Taunton. It needs to happen around the county and in our local communities. And we need to improve residents' lives through reduction of inequalities. We have large pockets of high indices of multiple deprivation around the county. And bluntly, we also need to reduce demand for expensive acute services. We need to sort problems, support families sooner. Connect Somerset is started very much as a philosophy drawn on the work of other county councils around the country and how it might be implemented here in Somerset. And one of those philosophies is that it's transactional. Effectively, rather than waiting for the next meeting to find some support for a family or a young person, we pick up the phone. And we pick up the phone to people with whom we already have established links, we already know well, we already know what they can do and what they can't do. And we help that family, that young person, through providing those links and getting them the support as fast as possible and without them having to repeat themselves at every stage of the process. That support might come direct from parents and carers, or it might come through the schools, it may come through a whole host of other ways. It could come directly from the young person themselves. The way that Connect Somerset is trying to achieve that is firstly by appointing 12 champions, one for each part of the county. And here is a sort of list of areas. These are based on the primary care networks, so the connections of GP surgeries around the county, but they're also really linked in with the new local community networks and the school clusters as well around the county to make them as joined up as possible. Each neighbourhood has one Connect community champion who is responsible for coordinating, linking up and improving all of the services within their area. I'd like to give some really practical examples of how we've done that in South Petherton and Somerton, which is my area. We've got a number of threads at the moment. I've been in to meet with all of the heads, the Senkos of all of the schools in my area, and to make them feel more connected with county services. You're probably aware that some schools feel a little isolated, or they've isolated themselves away from statutory NHS county services recently. And making them feel more connected with those services and people is an important part of providing care for young people. But sometimes heads don't know where to start, and that's part of my role. Another part of our role is to find and improve and develop a hub within our communities from which parents and schools, carers can access services, and which professionals can meet with service users, with patients in their community, and where members of the public can find out information about services provided by the NHS, by the council, and by other third sector providers in their community. In South Petherton and Somerton, we're looking at reviving and rejuvenating the Martock Information Centre, which was a wonderful resource, existed before COVID, which has slightly subsided, but which is now coming back to serve a new purpose for the community. And Connect Somerset's been able to support that, both with time and with money, in order to make that happen. We have a number of strands that we're looking at the moment. The main ones we're looking at are our team around the school and more early help. And team around the school is a programme that was supported by council, involving a number of professionals working around the schools in each community. And it's taken on various different forms over the years, and it's just changed again recently. It's important that schools have links to named professionals within each of the statutory services, within the council, within the NHS, within other and the third sector, so that in busy lives they are able to find the most appropriate support for the young people in their care. And that there's been a bit of misalignment recently between all of those different parts, as there's been a lot of changes in the county, in the NHS, in the council, and in the third sector, and that's meant that some of those previous existing relationships haven't survived because people have moved around, and it's about reconnecting those heads, those Senkos, with the named professionals that can help in individual cases, and really tailoring that support to the support that young people need. Part of that improvement has been a digital improvement around a system called Transform, which is a system where heads and Senkos can see which organisations are supporting young people. That's really useful in order to make sure that all of that support is linked up and that good support is there. But also it's useful to understand what package of support has already been provided to a young person, so that heads don't sort of tread on toes in asking for something new that's already being delivered, and really focus their efforts on spotting where the gaps in support for that young person are and joining those up. And we also want to wrap help around families as early as possible, so that when families and parents, carers are experiencing challenges, we can support them by getting them the support they want as quickly as possible and as calmly as possible. And we do this through what we call relational practice, which is bluntly picking up the phone and knowing who you're talking to and sorting things out, rather than sending an email that goes into an inbox and sits there for a couple of weeks until someone has a meeting. And you know, we want that to be the old way of working, and the new way of working to be much more focused and tailored around the young person. We're focusing at the moment on a universal early help offer, and that's going to be one of the primary threads that Connect Somerset is working on over the next few weeks and months, to really improve and pour resource into a universal early help offer around the county in an equitable way, so that it doesn't matter where you live, the support is coming to you should you want it. What's the timeline on this? Well, we've got an ambitious timeline. We've got a number of things we're trying to do all at the same time. And that's right and important that we do that, because families shouldn't have to wait for those resources. We're doing some team around the school development. We're doing communications to school. We're building neighbourhood teams, early help teams. The council's doing some commissioning, so some buying of services from the third sector. We're working with schools on Transform and the way that they can access services, and on the way that they can find out more about young people and families where they think that support might be needed. And we're working with the NHS in trying to join up services between the NHS and schools, all of which amounts to a huge amount of work. I just want to give 3 final examples of where this kind of philosophy may be able to help. I think many people on the call or who are watching it later recorded will have experience possibly of accessing quite complex statutory services, maybe in the NHS, maybe the Family Intervention Service. Our point is that we need to we need to, for everyone's benefit, stop problems getting that far, that we can support people earlier on. So just 3 quick examples. They're fictional people, but they're examples of how we might be able to help. Tyler isn't going to school, but there's now a group of named professionals around the school. So the teacher, the Senko, the head can phone the village agent, for example, who can support Tyler's parents, Mandy and Matt, who are suffering and need support with alcohol abuse and some poor mental health. And in doing so and connecting Tyler's parents up with those services, it actually stabilises things at home a bit. And as a consequence, Tyler's back in school, and with all of the positive outcomes and advantages that come with that. Rose has been going in to see her GP on a monthly basis, sometimes for health needs, but sometimes because she's lonely and because she wants to be more connected with her local community. Maybe she's moved to Somerset recently, maybe she's suffered a bereavement. I think we can all think of people for whom this is true. A GP is able to link up and refer to a health coach through what's called social prescribing, and the health coach supports her in attending a talking cafe where she meets other local people and she volunteers for them as well. Through this, she becomes embedded in her local community again, or for the first time, and she's made friends, she's feeling like she's got a new purpose, and she's much more connected with the community she lives in. Finally, Mandy and Mason. Mason's got a speech and language challenge, and so Mandy and he attend a drop-in, and while they were there, the hub's able to look up a database of community with local resources and find a local group of other mums, parents and carers, children with similar speech and language needs. Actually meeting other parents who understand what Mandy and Mason's going through and support them with no judgment makes a huge improvement in their quality of life, just because they know that they're supported, that they're not alone, and actually there'll be new information there on where they can receive support for speech and language needs as well. I'm very excited about Connect Somerset. I think it's one of those amazing philosophies that starts as an idea and just grows like a beautiful tree. And what I'm really pleased about is how we've been able to do some really practical, useful things for schools, for parents, for carers, for families, for young people, just in the first few weeks and months that it's been going. And I can only see that with the great team we've got, getting better and better and more practical, useful support going towards early help and towards a team around the school and our communities. Thank you.